It's a stubborn problem, one that has continued to grow in recent years despite concerted efforts to address suicide. To talk about it, I'm joined by two people working on the front lines of that crisis. Colleen Rodriguez, CEO of Jewish Family and Community Services. Welcome back, Colleen.
Thanks for having me.
And John Eaton, Vice President of Complex Care at Wounded Warrior. Hi, John.
Hi, thanks for having me.
And a quick note, since we are discussing suicide in this segment, if you or someone you know is struggling or in crisis, help is available. You can text or call 988 or chat at 988lifeline.org. Colleen, what is the shape of the suicide crisis in the U.S. right now? What are the trends?
Sadly, we're seeing it trending up. There was a 3% increase in suicides between 21 and 22. We're seeing that same that's happening also in Jacksonville and Duval County. The average is one person is killing themselves at least every other day just in Duval County. So we're seeing it heading in the wrong direction.
Tell us what the increase is that we've seen. I mean, generally, how does the U.S. compare to other countries, in sort of the financial situation that most people are in the U.S.?
Well, we are seeing, we've talked about that before. We are seeing that our housing crisis, the access to food, those types of situations, the financial crisis that people are feeling, the stress that people are still feeling, even I hate to keep talking about COVID, but coming out of COVID, those years of isolation, we're seeing those still having impact. And we are really having to take a more holistic approach around suicide. Yes, it's a mental health crisis. Yes, we have to have mental health interventions, but we also need to look at what's happening leading up to that person feeling in crisis. And a lot of it is around the financial struggles that they're facing.
Colleen, it seems like there's just so much more attention paid in this community, particularly in Duval County, to homicide instead of suicide. And the reality is that, according to the state health department, there are far more suicides
Right.
than homicides. I think according to the most recent data in 2022, there was 156 homicides and 179 suicides.
Right. Well, we've done a lot better about talking about mental health and building awareness and trying to build our capacity to serve mental health needs in our community. But yet, we're still not talking about it as much as we need to. I think suicide is still seen as something to be ashamed of, or if having suicidal thoughts is still something that we kind of link with shame. Families don't talk about it. I know we're going to talk about veterans and them not wanting to speak about it and seek help. And so we still have some room to grow in that area. And I think that's why it's not the headline, that homicide still kind of leads the conversation. But I'm hoping we're going to start seeing some trends where we are getting more comfortable talking about it and having people say, you know what, I've had those thoughts, and where can I go for help?
I want to ask you, I mean, do you have conversations with, for instance, media? Very often, news organizations are reluctant to cover suicides for some very good reasons. It
Mhm.
can instigate copycat incidents. I think they very often are trying to respect the privacy
Right.
of a family in the event of a suicide. But is it important? Would you support more coverage of suicides when they occur?
I would. It's critical, actually. We need to be talking about what were the warning signs. There's a lot of people who say there weren't any warning signs. If we could be having more dialogue around mental health, what we're seeing, what people are saying, what led up to them feeling that way, I think that's critical. Information is power. We can make decisions, we can make policies, we can develop programs, we can have better dialogue and more education, but we have to know and we have to understand what someone was feeling and what led up to that. And so I think more conversation is very important.
John Eaton, I want to bring you into this conversation. We're talking about an increase in Duval County, more than 15% increase in suicides from 2021 to 2022, which is sort of the last year that we have data for. How much of that increase do you believe has to do with Duval County being a military community?
Well, I think that the increase in suicide rates among the average civilian sector is the same thing we're seeing in the veteran sector. So each year we conduct the largest survey of post 9/11 veterans, and our research is saying the same. And so 7 out of 10 of our veterans are experiencing daily symptoms of PTSD, anxiety, and depression. 25% have had thoughts of suicide in the last 12 months. 50% of those have been in the last 30 days. So we're seeing, to Colleen's point, the trends going in possibly the direction we don't want to see, but really encouraged by the way that communities are showing up to provide support. So to train individuals, whether it's nonprofits, veterans, other leaders, of the signs and symptoms of what to look for, but also how to ask the question. It can be a tough question to ask. And so really getting comfortable with that and realizing that we can all play a role in that life-saving question.
So, John, we've been learning so much this last year, largely from the media, less so from the Department of Defense, but we've been learning a lot about combat blast exposure and how that can cause significant traumatic brain injuries among people who've served in combat, and that it has potentially very serious mental health impacts. People who have TBIs, veterans with TBIs, have a suicide rate that's 3 times the national average. So, how is the community, like Wounded Warrior and other groups that help veterans, responding to that information?
Yeah, well, one of the holistic approach that we take really starts with having conversations with our veterans. And so, regardless of whether a veteran is coming to us for an alumni event, a connection event, or even financial support, we're having that question to understand what is their risk of suicide. Beyond that, in terms of clinical treatment, we've seen things like traumatic brain injury, suicide risk to be excluding factors in receiving post traumatic stress disorder care. And so the work that we've innovated with in our programs is actually put the veteran at the center. And so, how do we cultivate and really individualize our care to meet the unique needs of each veteran? And so, traumatic brain injury, even things like military sexual trauma, substance use disorder, are all integrated into that individualized approach.
Is there a sense that perhaps in recent years, though, that we've been responding to kind of the wrong thing? We've been very focused on targeting PTSD, and perhaps this whole time, many of those cases might have been a traumatic brain injury. Um, how does that shift just the overall discussions that are being had?
Sure. A lot of the conversations we have today are how can we look for and help support the innovation and research around a diagnostic, quantitative way to detect and identify traumatic brain injury. That can be done both prior to service, during service, and post service. But it really all looks at how can we continue to be upstream and think about providing increasing protective factors and awareness so that those things are caught early and supports provided real time.
So the Department of Defense says that more than 380,000 personnel have suffered some sort of TBI since the start of the war on terror in 2001. And during that same time, suicide rates have really skyrocketed. Um, it does appear to be more than just a correlation, or am I overreaching there?
I think there's multiple factors. So I think those are really factors that have helped increase our awareness of what service members are going through during that service. And then really encouraged working hand in hand with the DoD and the VA to provide programming while they're in service. So, for example, we know we've seen headlines about the epidemic we see of suicides in Alaska. That's even highlighted even more in the veteran population. We've had unique partnership with the DoD and the chaplains on the bases in Alaska to bring in mental health programming through experiential learning. We're getting active duty service members out in the environment, pushing them to the brink of out of their comfort zone. And what's happening as a result is increased psychological well-being, resilience, and then that continuation of having connection with their chaplain beyond that program. And so we know that connection saves lives, and this is really helping to build those within the active duty population.
If you're just joining us, we are talking to two experts in the field of suicide prevention. If you have a question or a comment, you can reach us at 904-549-2937. You can also email us at firstcoastconnect@wjct.org. Colleen, you alluded to this earlier, but why is it so hard to recognize the signs that, CNN did this really heartbreaking story recently about a young man in Virginia who took his life. His sister was living with him, and she was actually a mental health and suicide prevention advocate trained in mental health first aid, which is specifically designed to, train
Right.
people to see the signs. She said her brother showed no signs.
Right. Everyone is different. Everyone handles their grief. Everyone handles their depression in a different way. I think social media is impacting our young people. They see something, they get an idea. I'm not even convinced that some of the suicides were actually suicide attempts. They see something on social media, it's this new drug you're supposed to take, it's this new catchy thing you can do and videotape yourself while you're doing it, and then sadly it ultimately results in death. And so I think it's a combination, but I how you respond to something isn't necessarily how someone else is. And so you're kind of looking for the signs of how I would respond, but it looks different in you. I may withdraw, you may be outgoing, and it's just we need to be. That's why the conversation with people and really listening and finding out how was your journey and what was your path, because it's going to be different.
As someone who works in the field, I mean, how confident are you that you would recognize the signs in someone close to you?
Well, you always hope, right? You hope you're right. I think for me, I've always been very direct. And I think you just mentioned this as well. We have to ask the question, have you thought about it? Are you thinking about it now? Do you have a plan? Do you have access to your plan? Are you able to carry that plan out? What would you do if you were thinking about it? We get hesitant. We don't want to ask the question. It's a tough question. It's a tough conversation. We have to be more direct in our dialogue. That's within our families. That's within the medical profession and the mental health professionals. We need to be real direct about this conversation.
John, this is sort of a maybe bigger picture question, but 30,000 of those servicemen and women who served during the War on Terror have died due to suicide. That's 4 times the number lost in combat. Is enough being done to sort of prevent the exposure in the first place? And I mean, in terms of focusing on more peaceful solutions instead of, engaging in a kind of constant warfare for the last few decades.
Yeah, I think we're as we grow and get more of an understanding of suicide in general and then ways that we can intervene, I am really encouraged in the way that we're addressing it. Again, it's upstream. So we think about the risk factors that would make somebody likely to start having those thoughts of suicide, whether it's financial strain, loss of connection, isolation, um, homelessness. These are all things that we know are predictive. And then we also know there are protective factors, the opposite of those, being able to put food on the table, having deep, strong social connections. And so looking at that as working backwards and building those supportive factors is something that we're very encouraged working with DoD and VA to do that. And it really comes down to what are we arming, whether you're a veteran or not, or a service member, what tools do you have to really see that and be open to those conversations, whether it's you or whether you see it in a battle buddy.
I saw an interesting statistic, and I was just curious about it if you had any thoughts. It basically says that people who served and they were not deployed are likelier to take their lives than someone who did deploy. They found that veterans who served in Iraq and Afghanistan, the suicide rate um, was 48% lower than the people who were not deployed.
I think that, and kind of to Colleen's point as well, everyone experiences traumatic events in a different way. What we understand too is, through our programs and really unpacking that, we're seeing that it could maybe be trauma related prior to service, whether it's childhood trauma and things throughout their growing up. And so I think it's such a complex issue that we can't really just focus on what's happening during that service, but also what's happened throughout their life. And so again, that highlights just the vast nature of this as an issue, and really our approach as well, a holistic approach. And so we don't just look at mental health as the only or even sometimes the best intervention. We look at how do we improve quality of life. And so that's around mental wellness, financial wellness, social connection, physical health, as well as our spiritual health and well-being.
Sure, but do you have any sense? I mean, if we're talking about, people who serve in the military having such higher rates of suicide than civilian populations, and you have this section of the military that didn't presumably see a combat circumstance, why that rate would be elevated among, I mean, is there something unique to the military service?
I think, we know that veterans are seeing a higher incidence of mental health conditions as a whole compared to their civilian population, right? And so civilians, on average, 3 to 4% of the population experiences thoughts of suicide in the last 12 months. That's upwards of 28% in a active duty service member population. And so one of the ways we're advocating so we can be more informed is through things like legislation, the STRONG Act, and providing research dollars to learn more about cause of suicide, different risk factors within both of those populations, and then also increasing access to care within the VA and DoD for support.
So this work is difficult work, Colleen. How do you, and John, you too, I mean, how do you keep from burning out?
We have to take care of our staff for sure. We have to be providing support to them. I think that every success story, every family or individual that comes back and says, "You helped me," this is how you've changed my life. That makes it worthwhile. But we do have to pay attention to our staff. They're hearing the stories. They can have secondary trauma by hearing what the person is going through and what they've experienced. And so we do need to make sure we're also taking care of our caregivers. And I think what we're both saying is really we need a holistic approach around mental health and around specifically suicide, both for the individuals seeking help and those that are caring for them.
John?
And I echo those thoughts. And really, a integral part of suicide prevention is thinking about the postvention component,
Right.
not just to the individual who had those thoughts, but others affected, family members, the individual who is helping support them. And so, postvention and self care is deeply rooted within our approach to suicide prevention and really vital because we want to be in this for the long haul. And we know we're serving 215,000 veterans at Window Warrior Project, and we made a promise that we would be there. And so, investing in our team and building up that resilience and giving them ways to cope and have that self-care is really important.
Are there signs that you think this community is making in terms of meeting those other needs, those underlying social and economic challenges?
There's a lot of conversation about affordable housing. We are seeing food pantries expand. JFCS is expanding their food pantry. We are finally talking about the social determinants of health. I mean, that was a phrase no one ever even heard of, and now we're really talking about that. We're identifying that the person is a whole person and that there's lots of components and there's lots of factors that led that person to our couch. That's to say that I'm in this crisis. And so I think the dialogue is important. We need to take action. We need to look at our policies. We need to look at our legislation. We need to understand it's not usually just one event, that there was a lot of things that led up to it. We spend more money on intervention, and we need to really be looking at prevention. What can we do to keep people from getting to that point? It'll be better for our economy, and it's better for our individuals as well.
Just a note again, if you know somebody that is struggling or in crisis, you can call or have them call or text 988. That's the emergency crisis lifeline. Colleen Rodriguez and John Eaton, thank you both so much for being here today.
Thanks
Appreciate
for
it.
having us.
Thanks.